Hello, this is Dr. Tony Naldo. I'm here to talk to you regarding our cool down phase passive molding using posterior L5 decreased sacral base blocking. Now the reason why both of these are put into one video is because the blocking is exactly the same whether you have posterior L5 or decreased sacral base. Here's the actual indication for both this type of blocking. Here you can see an x-ray here on the left with a posterior L5. Now the reason why I picked this x-ray because you can see they actually have a posterior L5 but they actually have an increased sacral base. So with this x-ray right here you may have a second consideration whether you want to do this or not depending upon the case. Here with here on this x-ray where they have a decreased sacral base here on the right, you can see this x-ray is a classic scenario. Decreased sacral base, and we also have a posterior L5. We have both things indicating this type of blocking. This type of blocking would be extremely effective for this case. However, it could be possible for this case as well. It just depends on what I was trying to do and what I was trying to correct and what I felt was stable. It doesn't look like it's extremely increased. I would probably do it on the first film as well, especially if the patient had any kind of low back pain or any kind of sign of L5 situations like numbing down into the legs or anything like that. So let's talk about how we actually do the blocking. So blocking is done very simply. The patient is done laying face down. Their forehead will actually go onto the cervical roll, and it's basically both these blocks will be pointing down towards their legs, and they're kind of lifting the ASISs with the blocking system. It's traditional Cat 3 SOT blocking. Again, been used for a long time. Very effective. Here's the patient doing it. She is laying face down. You can actually see the cervical roll right here in the bridge of her nose, right around her forehead area. And you can see these blocks are actually lifting her sacrum back, so we're increasing the sacral base and allowing L5 to go more anterior. Now they can actually perform an exercise on this. They can push their abs straight down into the table to actually create an assist in actually increasing that sacral base and decreasing that posterior L5. So let's go through the steps. It's done to reduce posterior L5 and decrease sacral base. The instructions are done that it's done for a 20-minute cool down period. Again, it's done once per day, and it can be done after any activity. Remember, anytime they warm up their spine, they can do the cool down phase. Warming up their spine can be any kind of activity like jogging, running, max T3, any kind of exercise that they're doing to cool down. To activate their spine, they can cool it down like this. Because once your spine is warmed up, it has a greater effect. Creep can have a greater effect on changing it. They can push their abs down to the floor to assist in the correction. And they do this for 10-second holds for as many times as they want. Let's go ahead and watch this video on how we perform this type of blocking, and I'll be back with you once we're done.
Hello, this is Dr. Tony Naldo here talking to you regarding your home care blocking system. Today's position I'm talking about is something called posterior L5 or decreased sacral base. Now this position is help restoring the normal position of your pelvis and your lumbar spine relative to each other. The blocking system is designed to use three parts. You have your cervical roll. You're going to be always using the large roll for this one because you're not going to be laying on the back of your neck. And then you're going to be using your spinal wedges. They're going to be set up in this position just like that, kind of pointing down with the thin parts facing the center of your body, the thick parts facing towards the outside of the body, kind of like just like that in that position. And this is the only blocking system that's actually done face down. We actually do this one face down. So let's go ahead and show you how we do it. So let's get these out of the way. Go ahead and get you lay face down right here. This roll goes on the bridge of your nose. And the idea is just to provide a little bit of support for your neck so you can kind of relax like that. And the main part of the blocking is going to be down here. Just get your arms on the side just so we can kind of see. This will go under your pelvis like this. Good. And then this will go under your pelvis just like that on the other side. And the idea is that it's going to rock your pelvis upward. And then you can kind of just relax your hands. Okay? And it's kind of rocking the pelvis upwards like this to drive L5 forward and the pelvis up in this position. So it's a very simple position. You just lay this for 15 to 20 minutes. You can go up to 30 minutes this way. This is not a position that you would sleep in though. You don't want to sleep like this. This would be a position that you would just use for the time that your doctor prescribed for you. So one thing you can also do is you can do an exercise while you're while you're doing this position. And the exercise is very simple, is that she can just contract down into the table, kind of forcing her spine down into this table or pushing her stomach to the table. That will help restore this normal position, help drive L5 more forward, and help rock the pelvis more back. And then you just relax. So you do it for 10-second contractions. You can do that several times throughout the 20-minute period to help restore this normal position. So make sure you follow your doctor's prescription on time and what blocking that you use here. But this is a very good setup to help restore that normal lumbar curve.
Now, to do this in the office can be a little difficult, but a lot of times patients can pre-block themselves while they're actually waiting for the doctor. So if they're waiting for the doctor for a few minutes, they can actually be laying down in the blocks, applying creep to their spine so they can actually get a better adjustment and actually help restore that normal motion between L5 and sacral base. I hope you enjoyed this video and how we use posterior L5 decreased sacral base blocking. It's a very effective form of blocking. It's been around for a long time in chiropractic. I hope it serves you and your patients very well.